I can go ahead and show some proper techniques when you're prescribed a nasal spray. It could be any one of the sprays. There's several out there. But the proper technique is when you get the bottle that you prime it first. Some bottles actually are a meter dose inhaler, so you prime it. It's a puff that comes out, and so those are some that can be used in the nose. This is a liquid-based product. Some you have to shake, some you don't. So it usually recommends that you shake this particular one, and it's a Flonase-based product. And you prime it. Basically, you push down on it to get the mist first, so that you know that there's going to be medication in there. Okay, and the proper way to spray this in is to put your head down like this, pull your nostril out with one hand. So my left nostril I'm going to spray with my right hand, but I'm pulling my nostril out with my left finger, okay? Now, one mistake that many people make is that when they spray it, they snort it in. And so when you spray it and snort it, guess where it's going to go? It's going to go into your throat immediately, and you're going to taste it and you're not going to like it. And it's not going to be as effective because it's not staying where it needs to stay. Okay? So when you spray it, you don't inhale, you let the medication go in the nose, and then if you need to sniff back a little bit so it doesn't drip out the front, then you do it after you put the spray in. Okay? So once again, you might need to sniff a little bit to keep the medication up in the nose. Proper angle is up and slightly out. So it's almost towards the corner of your eye where you're trying to get that angle. Okay? Now I see a lot of people use the right hand to spray both sides. And so what happens is that if you're right-handed, the angle is perfect for spraying your left side. It's not perfect for spraying your right side. What happens is that you end up spraying right onto the wall, that septum, which we talked about earlier, the wall that divides the left and the right side of your nose. And if the spray collects there, it tends to cause an irritation. It can cause bleeding. So that's where we get into bleeding issues with some of these medications. The proper technique for spraying the right side is head down. You pull out with your right, you pull your right nostril out with your right finger, and you spray just the opposite with your left hand. And you might need to sniff again after you put the spray in. Sniff slightly to keep the medication in the nose. Okay? So that's the proper way of using a nasal spray.